we're gonna move to the very interesting part now with the NIPT Golden. To be honest, not because I'm with Wellness Map, but this specific NIPT test is different than any NIPT test that you're gonna see in the market, because it is the first of its kind to be able to separate the fetal fraction from the mother DNA, and to be able to look at the mother DNA separately along with the fetal DNA. As we all know that when you take blood from the mother when she's pregnant, the fetal fraction or the fetal DNA will be mixed with her own blood. So meaning that we cannot separate the mother's DNA from the fetal DNA except with very specific bioinformatics tools that were developed to look at such a thing. And here in the NIPT map, we have different sections. We can divide them into five main sections. The first section is the trisomy. Okay, the second section is the sex chromosome aneuploidies. The third section will be related to the genome-wide screening, and then after that we have two other sections that are related to the mother, which is basically polygenic risk score on whether the mother could get any type of diseases that are related to pregnancy or not, depending of her genetic makeup. Then after that, we're going to look at the nutrigenomics and say, according to her DNA, what are the type of food that she should be eating and what are the type of food that she shouldn't be eating, or her body won't respond to it well or won't be able to absorb the nutrients well in her when she's eating. Okay, so now also as all the tests, you're going to see the details of your patient in the beginning. Then after that, it's going to give you the result, whether it is detected or whether there are anything that is detected or not. It gives you the fetal sex, which is male or female, and then it tells you the fetal fraction, which is 14%. A very important thing that we need to understand is that fetal fraction, the minimum should be around 4% for us to be able to say whether this NIPT result is actually reliable or not. When it is lower than that, then we won't be able to say for sure whether this NIPT test is actually reliable or not. And something that is very, very important when it comes to NIPT test in general is that the mother, if she's obese, if she's taking any sort of aspirin or blood thinners, this affects the result of the NIPT test. And it is very important to communicate that with the patient before taking the result, because we've seen a lot of patients that they freak out when we ask them for a second blood withdrawal because there wasn't enough fetal fraction in the first one. Okay, and they think that there's something wrong with their baby or whatever. So it's very, very important that we communicate those type of information with the mother before we do the test for her. So if we ask for a second blood withdrawal, she does not freak out or cause her some anxiety. Okay, moving on, then we see the results. We see the first part that we talked about, which is trisomy. We see that trisomy 21, 18, and 13. And we see the background risk. So the background risk is basically how many infants globally could be affected with such a disease. So in the trisomy 21, for example, we see one patient in 370 infants are affected with that disease. Same goes for the trisomy 18, which is 1,020, and then trisomy 13 is 3,081. And then the Neptune risk score is basically what we've detected. We can see here that it is low risk, and we didn't detect anything that could say that this patient has any sorts of alteration in the trisomy specifically. Then after that, we see the sex chromosome results, which is XY in this case. We see the fetal sex, which is male for sure, since the chromosome is XY, and then the fetal fraction, which is 14%. Then after that, we see the sex chromosome aneuploidies, which are Turner syndrome, trisomy X, Klinefelter syndrome, and Jacobs syndrome as well. And if it is low risk, we're gonna see the chromosomes as green, and if it's high risk, we're gonna see the chromosomes as red. And this specific case, we do not see any red chromosomes, which means nothing was detected. Then after that, the genome-wide screening, where we're looking at the 22 chromosomes as a whole, okay, and whether they have any aneuploidies or any issues with the chromosomes itself. And we can see that for this specific sample report, also everything is green. We do not see any red chromosomes, meaning that the patient is fine. And that's the end of the fetal part. Then after that, we start seeing the mother results. Okay. And then in the findings for the sample report, we see that this person had a prenatal gestational predisposition. Okay, and that a polygenic analysis has detected that it is significantly high in the specific case. That's the summary. Again, we're going to see the details later in the report. We can see that also in the summary, what are the things that you may need more? What are the supplements or that you may benefit less from? And what are the supplements that you may benefit more from? So the need is what is important. The benefit, it could be something that she could benefit from, but it's not essential for her to take during pregnancy. Okay. Then after that, we start seeing the prenatal gestational condition. And the metrics is basically three different metrics that we see here. We see the green one, which is okay. There isn't any issue with that, and it's similar to the rest of the population. We can see slightly high, which is orange, meaning that this specific person has a higher risk of developing such a disease. Okay, again, polygenic risk score, just like the risk map that we've explained last week. It shows the risk, but it does not say that this person will have such a disease. But it gives us the ability to change the lifestyle that we're following to make sure that such a thing does not affect the mother. Then we have the higher, which is dark red, and this means that it is actually very high because the genes that we've seen lead to such a condition. So what are the conditions that we're seeing? We can see the low birth weight. Okay, low birth weight meaning that this person will probably deliver an underweight baby. And it tells you here as well in the middle, the general population risk. So we can understand the risk value of such a disease on the whole population and on our patients specifically. Then we can see that the patient's relative risk is slightly higher. Okay, so she has a slightly higher risk of delivering a low weight baby. Then we have the gestational diabetes. Okay, here we see that 11 to 14% of the general population has such a risk. Okay, and then the relative risk for this patient is normal, similar to other patients or other mothers out there. Then we have the gestational hypertension, also 6 to 7% population risk. This patient is normal. We have postpartum depression as well, which we see a lot of females or mothers are suffering from after delivering, and here we see 4 to 6%. We see the relative risk is similar. We have miscarriage as well. The general population risk is 6 to 7%. Then we have the hyperemesis, and in that specific condition, causes severe nausea to the mother, and we can see that it is from 0.5% to 1%. We see preeclampsia, and it is very important for the patient to understand whether she has the risk for such a disease or not, because if it develops, if it's actually ignored and we do not take care of it, we can see that patient could reach to the eclampsia stage, which causes a lot of issues during pregnancy. Then we have the preterm birth, and that means delivering before the due date with a long time. So that risk is 11 to 14%. Then after that, we come to the nutrigenomics part, and the nutrigenomics part is the essential nutrients that the mother needs for her own health and her baby's health. And we can see the best thing about that as well, that the patient could read it and understand